We can go ahead and get started. Thank you so much for joining our Volunteer Voices online conversation. Just before we get started, we have a few housekeeping items for you to know. So that you're aware, we are recording, and all participants in this online event will receive an email from me containing the link to the recording just to watch it back, as well as the link to sign up to volunteer if you do decide that you would like to pursue volunteer opportunities with Global Care Force. There will be a question and answer session at the end of the presentation where you can ask the volunteer presenting some questions. So if you have questions, please hold them until that moment, or feel free to write them in the chat for the session, and we'll get to those later. So who is Global Care Force and what do we do? Global Care Force is purpose and mission is to transform lives through volunteer service. So we connect volunteers to organizations that serve people in need all over the world. Our volunteers serve without distinction, and we have cultural competency and respect, and we also are faith friendly. Our goal is to continue to provide primary care teams to areas lacking in access to medical care, and we are a 501c3 registered nonprofit. Where does Global Care Force serve? So we serve in Egypt, Jordan, and Ukraine, and in those places we send primary care teams. We send individual volunteers to El Paso, Texas, Gallup, New Mexico, Rosarita and Tijuana, Mexico, and San Francisco. Today, I am very excited to introduce you to one of our amazing volunteers, Dr. Daniel Brooks. Dr. Brooks, thank you so much for taking the time to meet with us today. Can you please tell us a little bit about yourself? What is it that you do, and where are you from?
Yeah, I live in Phoenix, Arizona. I'm a medical toxicologist. I've run a poison center for about 25 years, but I'm also board certified in emergency medicine and addiction medicine. So I've done academic and clinical work for the last 25 years.
Amazing. And what made you decide to volunteer with Global Care Force?
Yeah, I was looking for an organization that had established contacts in overseas areas. I'd worked in Japan and taught there for about 8 or 10 years. And due to my employment status, I couldn't make commitments for 3 or 4 or 6 months like several other organizations. So the couple of weeks that I was able to spend with you folks in Ukraine was perfect.
Yeah, so can you tell us a little bit about your Ukraine experience? What made you choose Ukraine specifically out of the different volunteer opportunities that we have?
Yeah, I'm actually Polish and Ukrainian descent, so I've got some personal interest in what's going on there, family members and friends there. And it was just a calling, what they're going through and continue to go through. I felt they needed as much support as we can give them from all around the world, especially the United States. So it was important to me.
Amazing. And can you give us a little snapshot? What is a typical day in the life of a volunteer on the ground like?
Yeah, I mean, it's compared to my normal job, which is, working in the mostly when clinically I'm working in the intensive care unit or the emergency department. This is lower acuity. I mean, they're long days, but they're not physically or cognitively draining. There's a lot of emotional issues. Obviously, these folks have been through a lot of psychological and physical trauma and had their lives in countries rooted. So it was very fulfilling. Long days, but not challenging physically. And as you mentioned, this is mostly primary care and delivering some healthcare. Most of it's for primary care stuff. We saw some acute issues, but those were not prominent. And then I think a big part of what we do is just to remind folks that they're not forgotten, and that people around the world are still thinking about them and trying to take care of them.
So you touched on this a little bit. Can you tell us what the most challenging part of volunteering in Ukraine was, and what was the most rewarding?
I mean, for me, there was no challenging there was no big challenge. rewarding was just being able to help people out, being a real healthcare provider and a real physician. I mean, I'm not sure who's on the phone, but in our country, unfortunately, we're not very efficient in healthcare. It's just a lot of bureaucracy and paperwork, and dealing with insurance companies. And I don't feel like much of a physician for the last 10 years for sure. But that changes working this work. That's all you do. There's no billing. The paperwork is superfluous. It's just being a healthcare provider, whether it's a nurse or doctor, PA, whatever. But for me, it was just being a real physician and taking care of folks.
And can you share a story about something that happened while you were on the ground, or someone you met that will stick with you for the rest of your life?
Oh, there's a lot of them. The people are very genuine and appreciative. It was just it was a very, very rewarding experience.
And our teams often come together as strangers, but we've noticed that quite a few team members stay in touch afterwards and become fast friends. What was your experience of teamwork on the ground, and even with our global care force staff on the ground?
Oh, it was great. They're good people. I mean, I I've only done this once, so it was you know uh, just this my first experience, but they're good folks. I mean, we had a great time. We became very good friends, and had a lot of teamwork, and it was a privilege to be there with everyone, both the Ukrainian folks particularly, because they're very, very appreciative of what we're doing, and all. Most had a healthcare background, and then the folks that were put together, from the states to go over and to help out.
And sometimes coming back to your normal life after being on the ground can be quite a shock to your system. How would you say that your time volunteering has impacted the way that you approach your day-to-day life back in the US now?
Yeah, it's just put things in perspective. You see what these folks have been through, and then we come back to, you know, what I like to describe as first world problems. Worrying about internet speed or traffic driving to work, and it just doesn't matter. And same thing when I'm back at work, and worrying about stuff, and all the nonsense that we have to put up with bureaucracy and emails and all that nonsense. And then it was just a nice reminder that there's still lots of need out there for healthcare providers in our country as well. It's not just overseas, but it's all over the place. But you just have to search a little bit, and then you'll find opportunities, I think, to really help take care of folks and make a difference.
Absolutely. I just received a question asking about this man in the photo with you in front of the car. Can you tell us about who that is and what the story
Yeah, he
is
was my
behind
last
that photo?
patient. He's my last patient, actually, last clinic day, and he was just a very nice guy there with poorly controlled hypertension, diabetes. We got him on some meds and spent some time talking to him. He'd been through a lot. He had just gotten back from one of his long time friends' funerals, and then he actually, I like cars. He let me drive his Lada, so I was able to drive his. I think that's an '86, or it's over 30-year-old Russian-made car. But yeah, he was a good man.
That's amazing. And in your eyes, what impact would you say Global Care Force is making as a whole?
Exact their mission. I mean, they are just helping take care of folks, and you can't underestimate the importance of having people show up on the ground and just remind people that they're not forgotten. I think that's probably just as important, if not more important, than us delivering the care and handing out medications. Our pharmacy, we had that's one of the problems is limited pharmacy, and we ran out of lots of medicine, but it's we were still able to deliver care and do stuff, and it was just very rewarding overall.
Okay, thank you so much, Dr. Brooks. I am now going to open it up. Does anyone else on the call have questions for Dr. Brooks about his time in Ukraine? Okay, if there aren't any questions, then I will go ahead and explain. what the volunteer process is if you are interested in volunteering in one of our locations. So, first up is that you would go to our website, www.globalcareforce.org, and sign up. And then once you sign up, you will begin the volunteer screening process and go through the interview process with our team. And we would begin onboarding you if you are approved to serve on a team. And you would go through the training process to prepare to deploy. And then you go ahead and just like Dr. Brooks, you're on the ground and you are serving and having a wonderful and transformative life experience serving those in need. And once you get back, we ask that you advocate, just like Dr. Brooks did today, by telling your story about what you saw and what your experience was on the ground. Well, that is all for our call today. There is one question. Anupama, am I saying that right?
That's correct. You're
Okay.
saying it right. Yeah, I go by Anu because it's easy and short. But I'm a volunteer coordinator with Heartland Hospice. And my question is to you, Miss Brenda. So you guys do it globally, those countries that you mentioned, and you mentioned Texas. So is there any other states you guys are serving or not at this moment?
Yes, so we also volunteer, send our volunteers to work with the Sisters of the Missionaries of Charity, which is Mother Teresa's order, and they serve in Gallup, New Mexico, as well as Pacifica, California. Those are medical and non-medical volunteer opportunities, and it's not teams going there, they are individuals who are serving in hospice type settings and homeless shelters.
Thank you so much. I just wanted to know because I'm located in Virginia, but I just wanted to participate and know about what else is out there and how many people are doing things to help the community because that's basically the role that I took when I take this job.
Okay, absolutely. Thank you so much for asking. And like I mentioned earlier, I will be sending an email to everyone with the link to sign up. And that also takes you to our website. So if you are interested in learning more, you can do a deep dive on our website as well. Dr. Brooks, thank you again so much for joining and telling us your story. We would love to have you volunteer with us again, of course. And we hope that you all have an amazing day. Thank you. Bye-bye.
Thank you so much. Have a great day, everyone.